Welcome back to Living Local. Joining us today, we have Dr. Marcella Tabor. We're here at Partners in Primary Care off of Remount Road. Thank you so much for having us today.
Thank you for having me, Ashley.
All right, first off, let's talk about Partners in Primary Care. What do you do here?
I'm a family physician, and Partners in Primary Care is a senior-focused clinic.
Okay.
Here on Remount. We have another office in West Ashley.
Okay, and so all about seniors, because that's a big group here. You know, we have a bunch of people coming from other states to retire and things like that.
Absolutely. This is all about seniors. It's specifically designed for seniors in mind. Our design is such that our floors are non-skid, our openings are wider to accommodate for, I wish I had something to do with it, to accommodate for wheelchairs and walkers. Our wait times in the waiting room are shorter and our appointment times are longer, so we get to spend more time with our seniors.
So you have that like bedside manner, you get to actually get to know them, I'm sure.
Absolutely.
And I noticed that y'all communicate a lot here, and I think it's because you have this whole team, right?
That's right. That's an important part of our model. We have a multidisciplinary team. We work closely together. We have
you have different tiers, like
we have a nurse,
branches of it,
we
right?
have a nurse care coach. We have a behavioral health specialist. We have a pharmacist. We have a whole referral coordinator. It's all a huge part of the team
whole process,
approach.
right?
Yes, to
and that's
patients.
what makes you different.
It definitely sets us apart.
Because wouldn't you have to kind of go somewhere else? You'd have to, if you go to your primary care person, then you'd have to go to all these different, so it kind of like a one-stop shop. I mean,
absolutely, and more importantly, but all the members of the team are communicating with each other on a regular basis too, and that helps to just coordinate our patients'
and
care.
I bet y'all learned so much about your patients too. You're like, Mr. Smith is going on a vacation.
There's no doubt, because every person approaches the patient's care from their own angle, and putting together, we all get different information.
Perspectives too,
absolutely,
probably.
And it helps us to bring our personalized care plan for the patient together.
And I bet as a physician, it probably helps you be even better at your job, right?
Oh, it's wonderful.
Because you're getting more information and you're learning even more during that process. All right, let's talk about annual enrollment period coming up.
That's right. We're right in the middle of the annual Medicare enrollment period. Where Medicare beneficiaries are assessing their plans, possibly getting plans for the first time or enrolling in different plans. And that's happening now until December.
And we heard from our friend Lori Miller that there's a lot of different plans and things that have changed and things like that. So that's definitely something to take a look at, right?
Absolutely. Everyone should probably relook at their plan, make sure that they're getting the best value, the most services in their Medicare plan.
All right, if I'm a new patient, how do I go about that process for coming here?
Give us a call. We'll
you have convenient locations?
We absolutely we have convenient locations. We'll assess, we'll do an evaluation even over the phone. First and foremost, we want you to give us a call, find out what we're like. The other thing you can do too is we're giving personalized VIP tours of each facility too, and we'd love to show you around.
Nice. And they've got goodies, which I love. Okay, before we head out there, let's kind of talk about annual wellness exams. How does that work?
That's right. An annual wellness exam is an important part.
Is that like a physical?
It's much more than a physical.
You're like really focused on seniors.
It's a part of a Medicare plan, and it's a once-a-year visit where we do a real comprehensive look at a patient's overall care. We'll evaluate you from an immunization standpoint. Have you had all of your preventive immunizations? We'll review all of your medications.
Reviewing medications and things like that.
Absolutely. Do you have some that we don't know about? Do you need to be taking all of them? Let's look at that. We'll address any issues that you'll have. We'll review all of your chronic illnesses. The other thing that's very important too is we'll be sure that we have ordered and followed through with all of your preventative services too, because staying healthy is an important part of our model too. We'll discuss diet and exercise, and last but certainly not least is we're going to ask you some questions, and we're going to look at you from a social and behavioral aspect to see how you're doing, and that's what really makes a whole comprehensive care.
And as a physician, do you find that a lot of times those areas get neglected because the hustle and bustle, everyone's going around and things like that, and that oftentimes these areas, which are super important, get kind of left by the wayside?
That's absolutely true, and they can actually be some of the major barriers to a person getting the health care they need. And for a lot of reasons, we don't know that, but understanding that helps us to navigate and find the best possible, absolutely, and get the best possible solutions.
Right?
Absolutely, that's what it's all about.
Well, thank you so much for having us. For more information, head online to seniorfocusedcharleston.com.